Have you been diagnosed with a herniated disc and you're wondering, what do I do now? Or maybe you just have some pain or dysfunction and you feel like maybe it is a herniated disc and you're just looking for some answers before you go seek out some specialist treatment to figure out what to do about it. Well, I'm Dr. Amy with Physical Therapy for Everybody, and today we are talking all about herniated discs and what you can do right now to help yourself. You ready? Okay, first thing I want you to do, if you've been diagnosed with a herniated disc or if you think you might have a herniated disc, is to realize that this is completely normal. I know that's probably not what you're expecting to hear, but actually the research really clearly indicates that many of us, a large percentage of us, will have a herniated disc at some point in our life. So, welcome to the club. It's pretty much going to happen to everybody at some point during their life. Now, I realize that that may not make you feel better right now if you're in pain, and I totally understand that. But I think it can help to just decrease the anxiety a little bit, to realize that you probably know other people who have managed to make it through a herniated disc and are living the life that they want to right now. And you can too. We've got more tips to talk about this today, but I just want to reassure you, you can get back to everything you wanted to do. You can get back to running and yoga and picking up your kids and all the things that you love doing. You can do it even with a herniated disc. All right? On to step number 2. In order to do all those things you want to do, you need to keep moving. Now, I know, again, this can be a tough one to swallow initially because you're thinking it hurts every time I move. And especially if it's recently herniated, I totally get that. And many patients I've had come in here who have a herniated disc, all they want to do is lay down or sit down or whatever their position of comfort is because it hurts whenever they try to move. I totally get that, and I 100% respect that. If this has happened within the past 3 days, you probably need to be more sedentary right now because everything's really angry and really inflamed. And you do need to give yourself a couple of days. However, if you're beyond that first 3 to 5 days, I do need you to get up and keep moving. Now, what movements should you do? Here's the key. You should do the movements that are pain-free. So, if bending forward to pick up something from the floor is painful, then that is not the motion I want you to do. If bending to the side or twisting or anything like that is what's painful for you, then that's not what I want you to do. I'm going to show you later on the best exercise that I give to my patients who are struggling with a herniated disc. It's actually the exercise that I had a patient call me one Saturday morning. She was plugging in the vacuum, boom, disc herniated. She literally called me from the floor and said, what do? I can't get up. And this is the exercise that I gave her to do. So we're gonna show you that later on in this video, so watch till the end. It's one that you can do that will be safe and pain-free. I don't want you doing any motions that are painful right now. Obviously, we're not trying to increase inflammation right now. We're trying to calm everything down. So avoid movements that are painful, but move as much as you can pain-free. After that first 3 to 5 days, I recommend that people get up at least once every hour. And if it's walk around the house, if it's get a glass of water, if it's whatever, just to get moving, because when you sit or lie down for a long period of time, it allows that disc to kind of slide around, which can actually end up making your problems worse when you do get up. Okay, so I need you to keep moving at least 5 minutes every hour, if not more than that. Do whatever you feel is comfortable for as long as it is comfortable. I have some patients who will, in those beginning phases, they can walk maybe to the down their driveway or around the block, but that's it. They can't walk further than that. That's fine. Just do it multiple times per day because you need to keep moving, because that's what's going to bring that nutrition so the disc can heal, which is what the exercise we're going to talk about in a minute is focused on. The next thing you need to do, which I alluded to before just a minute ago, is stay hydrated. So your body is 80% water in general, but discs especially have a ton of water in them. Discs and throughout your spine are like sponges. And so basically they kind of squeeze, that's the movement. You squeeze and all the waste products go out, and then you unsqueeze and it pulls in all the nutrition. But if you're dehydrated, it's going to be harder to get the nutrition, harder to get that healing to the discs. So you really need to stay hydrated. And my friends, I know that there are some people out there who don't drink enough water on the daily. This is a great time to change that. Now, how much water should you be drinking? There's all kinds of different formulas. The two most popular ones are take your body weight, divide it by 2. That's how many ounces you should be drinking. So if you weigh 160 pounds, divide it by 2, that's 80 ounces of water per day. My personal favorite, which I heard from a patient, he said, drink enough water so your pee is clear, and drink enough water to keep your pee clear. Now, I like that one because I don't have to measure anything, and that's super easy. If I go to the bathroom and it's really dark, I notice, oh, okay, I haven't drank enough water today. I need to start staying more hydrated. Whichever one works for you. If you don't drink water on a regular basis, probably starting with that number is going to be more helpful because it's going to be really clear and objective, and you're going to see the results more quickly. However, if you do drink water regularly, you're just wondering if you drink enough, I advise the second one because you're a little bit more used to water drinking, and it just gives you something that you can look at to observe some changes. All right, number 4. And this one is critically important, my friends, especially if you have a herniated disc. I need you to use ice and not heat. So ice is to decrease inflammation. A herniated disc is 100% inflammation. That's what's causing the pain. It's actually not so much the disc, it's what it's pressing on and the fact that there's so much inflammation around it. And of course, there's all the nerves and everything in there which are getting affected by the inflammation. It's like a chemical bath around those nerves, and that's why it's bothering you so much. So we need to decrease the inflammation. That's going to be using ice. Now, I only need you to do it for 5 minutes. A lot of people have heard that they need to ice for 15 to 20 minutes. And if it feels good for you to ice and you like icing, I have no problem with 15 to 20 minutes. However, many of my patients are very sensitive to ice and it really bothers them. So they're very relieved to hear that the research indicates that we get the maximum benefit, which is decreasing the inflammation and decreasing the pain after 3 to 5 minutes of ice. Now, if you're in those first 3 to 5 days, you need to be icing once every hour, which is a ton, I know, but we need to be managing that inflammation. If it just happened, we've got to manage that inflammation. So I need you to be doing it regularly. Now, with my patients who have gotten to the point where they're able to kind of function on their daily activities, so they're not maybe able to go back to exercise or something like that, but they are able to kind of cook and get to the bathroom and take a shower, things like that, I recommend still icing at least 3 times per day. It is super critical that we manage that inflammation, and ice and movement are the 2 best tools we have for that. So how come we don't recommend heat? Well, heat increases blood flow, which you think is going to be good, right? Because we need blood flow to bring healing. However, if we have too much blood flow, we create a stagnant area. That means that the blood is bringing in all the nutrients, but the body is like overwhelmed and it can't even use them appropriately. That's what happens when we bring heat into this area. So in general, I don't recommend heat. There are a couple of specific scenarios I do, but please, 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 if you have a herniated disc or think you have a herniated disc, please do not use heat on it. It is going to make your symptoms worse. You may feel better initially. You may feel like, oh, that really calmed things down. It relaxes the muscles, right? But as soon as you get up, you're going to feel how unstable that area is, and you're going to create more trauma. So I need you to avoid the heat and use ice, especially in the first 3 to 5 days, but even long term, if you've been diagnosed with a herniated disc or if that's what you believe you're suffering from. All right, tip number 5, and this one's going to be another hard one. I'm sorry, guys. Today's just a hard one day, but this is really, really important. I need you to work on your deep breathing. So what happens is that when we have a herniated disc, all the muscles tighten down and lock up because the muscles, right, they're dumb. What can they do? They can contract and they can relax. They say, oh, there's something going on. There's a problem. We're all going to contract, okay? That causes even more potential herniation, even more potential damage, but definitely causes more inflammation and makes it more difficult for the blood flow to get in there. So we need to work on our deep breathing. And I'm talking about that deep belly breathing, not deep breathing with the upper shoulders, that deep belly breathing. The other thing that will do is it will stimulate that vagus nerve, which is your chill out nerve, and helps everything to calm down a little bit. And when you're in those really inflamed first couple of days, you need every ounce of calm down that you can get, okay? So find your position of comfort. You can even put some ice on, do some deep breathing while you're icing. 2 birds, 1 stone, and get in that deep breathing. All right, so those are our top 5 tips. I told you I would show you the exercise that I recommended for my patient. So we're gonna pause this video and be right back with you with that exercise.